Good evening. Medical services for thousands of vulnerable Minnesotans are in limbo as the state grapples with the cost of the fraud crisis. More than 3,300 Medicaid service providers are still waiting approval after increased state screening. That's out of nearly 5,600 providers designated high risk for fraud. Ashley Grams explains how more vetting could force some businesses to choose between their clients' well-being and their own financial survival.
Yeah, well, Frank, this all started months ago when the federal government said $2 billion in Medicaid funding would be held up if Minnesota didn't root out fraud. The state is now recertifying the businesses that provide those services.
There's your puppy buddy.
Building social and communication skills, helping children with autism become more independent. The owners of Minnesota Behavioral Specialists say that's their goal.
The kids we work with are the most amazing kids ever.
I think so. You did it!
Minnesota Autism Service Centers that bill for Medicaid are considered at high risk for fraud. One of 14 Department of Human Service programs flagged. After a new federal mandate to crack down on fraud or risk billions in Medicaid money, the state called on providers to resubmit paperwork to prove they're legitimate. The deadline to recertify those businesses passed this weekend. Paige Berland says their Bloomington Center lost funding eligibility, but their location in Eagan was approved.
It doesn't make sense. Everything is the same, minus the location, right? So why was one approved and one wasn't approved?
The denial letter said they failed to disclose a managing employee. Berland disputes that.
And we were told to keep running, keep continuing as we are while we go through this process. It just means that then we don't have the money coming in.
According to the latest data from the state, about 1,000 providers have been approved. Just over 1,000 have been disenrolled, and more than 3,000 have applications pending. Accessible Space is another provider in limbo.
All the information was the same that we provided for all 7 of them, so why 5 didn't get approved and why 2 did is your guess is as good as mine.
They provide in-unit care for people with spinal cord injuries and disabilities, a service also considered at high risk for fraud.
We're not able to bill for services, we're not able to start new services for anybody.
Both businesses say they have already started the appeal process.
The fraud that was committed needs to be stopped. There's no doubt about it.
Berland hopes children and families who truly need the services aren't caught in the middle.
Not just the clients rely on services, but the families do too.
Can I get a high five?
So we can't stop services. That's not an option on our plate.
DHS says they're currently in the process of compiling data from the thousands of applications, but did not say when they'd share those final numbers. Ashley Grams, WCCO News.